I am excited about the future of Michigan, but there's a couple barriers in the way. Got to figure out how to solve this healthcare problem that we have. Everything seems positive. Healthcare presumably is at its pinnacle of performance, but every single employed person who depends on their healthcare from their employer in Michigan is suffering. And it's been 20 years, 30 years, maybe even 40 years in the making of how our paychecks have been eroded by the increased cost of healthcare and then the increased cost of health insurance that's paid for by employers. Many of the companies that are doing everything that they can to pay you more, to retain you as a valuable employee, and provide what we do best here in Michigan, and that is make cool stuff. From our roots in Detroit to the manufacturers that have spread across the entire state, that is our heart. And I'm sitting here in what I would call the Michigan dream, the ability to go to your lake cottage, hang out, spend time with friends and family. And I'm fearful that that's not going to be possible in the future if all of our paychecks are eroded by the presumed inevitable cost of healthcare. And it doesn't have to be that way. For the past 5 years, I spent time fighting that. Spent time really analyzing how much is a knee surgery worth, how much is a carpal tunnel surgery, a Sympl hernia surgery. Are medications priced the appropriate way? And I can confidently tell you, after the time spent looking at this, that we're not paying the right price. And we have found a solution. We have developed direct contracts with care providers in West Michigan that provide excellent, if not the best, healthcare for elective procedures in West Michigan. But we've also found alternative sources for medications that, kid you not, could eliminate the cost of your medication that you're paying for right now. But we're fighting a battle that really stems from the lack of competition. That's it. How do we make care providers, pharmaceutical manufacturers, and frankly, even the pharmacy benefit managers and the pharmacies that supply those medications, how do we make them compete for your dollar? Everything else that we purchase is based on some form of competition, some form of, I can buy it down the road for less, but not medicine. We trust our primary care provider to provide that recommendation. But what's happened here in West Michigan? Primary care practices, ambulatory surgical centers, outpatient clinics. Over the past 10 years, they've been purchased and controlled by one organization. And although the marketing that you see sounds positive, and the idea of having one system provide healthcare for you and your family sounds like a holistic approach, it is not. I can confidently tell you that it is based more on the dollar than it is on your health care. It is based more on sick care than it is health care.